So I want to talk about periodontal gum disease that's so very common in really, starting at all ages, extremely much more common as we get older. And it's something that you have got to take serious. I ask you to please take it serious, because periodontal disease isn't just about the teeth, isn't just about the gums, it's about the entire body, the health of the entire body, and you need to take that serious. Let me explain why. I'll give you one example. One of the bacterias, well, first of all, let's talk what is periodontal disease. Periodontal disease is inflammation of the gum tissue. How do you know your gums are inflamed? Because maybe they bleed. They bleed when you brush, they bleed when you floss. It might be a little bleeding, it might be a lot. But that bleeding will affect the underlying bone and you start losing bony support of the teeth. Inflammation is something that our body does to try and correct issues that may be there. But when you have chronic inflammation, there's a lot of different disease processes that result from chronic inflammation. For example, gum disease, diabetes is an inflammatory disease. High blood pressure is an inflammatory disease. Autoimmune diseases are inflammatory diseases. And inflammation then that becomes chronic will affect our body. In fact, a lot of the disease processes that occur in our body are the result of chronic inflammation. So you need inflammation to get you out of serious problems, but chronic inflammation can be detrimental to your health. So let's talk about periodontal disease in particular. Periodontal disease results from a lot of different bacteria that affect our gums, our immune system, and provoke that inflammation. This is one that is interesting, and there's a bacteria called Porphyromonas gingivalis, okay? That particular bacteria is found in individuals that have gum disease. But one of the things that was recently found is that same bacteria is found in the brain of individuals that have Alzheimer's. Now, is there a correlation? Is there a tie-in to that? Is there a cause and effect? Well, it's being researched, but it's very interesting, because you think of bacteria is just right here in my mouth. No, it's in all your body, as is the inflammatory byproducts that result from the gum disease. So you have got to control it. You have got to, because it isn't just what's happening here, but what happens in the entire body, the whole system, if you will. I refer to the whole complex system. The body is so unique, but all the systems tie into each other. So you've got to control it. If your gums bleed, if you have bad breath, if you're seeing recession of the gum, if you have pain, and you really don't have to have pain, you've got to have your mouth checked. You have to control any inflammation that you have around the gum tissue. We will definitely help you, because controlling gum disease will really influence your entire health. So feel free to reach out to us, and we'd be more than happy to guide you. Thank you.